Hi, my name is Eric Olivares, and today we're going to be learning about diabetic emergencies and how to treat them at the EMT level. The goal of today's lesson is going to be to recognize and provide care of diabetic emergencies. So, our cognitive objectives are the student will be able to define diabetes mellitus, explain the function of glucose in the body, discuss the signs and symptoms of hypoglycemia and hyperglycemia, identify glucose levels, discuss the purpose of checking the glucose, explain how insulin and glucagon regulate glucose, explain the treatment of hypoglycemia and contraindication of oral glucose, define DKA, diabetic ketoacidosis, define HHS, hyperglycemic hyperosmolar syndrome. Our affective objectives. The student will be able to value the importance of ALS backup, defend the purpose of obtaining the glucose, appropriately perform glucose check via glucometer, and defend the importance of correcting hypoglycemia. The student will defend the importance of supportive treatment during hyperglycemic emergencies. There will be no psychomotor objectives for this lesson. All right, so diabetic emergencies. First, let's talk about what is diabetes. Diabetes mellitus is a disease in which the normal relationship between glucose and insulin is altered. Along with that comes acute emergencies. Things like hypoglycemia, which we'll learn about, which is low blood sugar, hyperglycemia, which you'll also learn about, which is high blood sugar, DKA, which is diabetic ketoacidosis, and hyperglycemic hyperosmolar syndrome. Try to say that 3 times fast. So, to have a better understanding of diabetic emergencies, you need to have a basic understanding of metabolism. Metabolism is how sugar acts in the body and how it's regulated through hormones like insulin and glycogen. There's 3 major food sources for the body cells: carbohydrates, fats, and proteins. Carbs is the major source of energy for the cell, which is made of sucrose, lactose, and starches, which are known as complex sugars. These are then broken down into simple sugars, known as glucose. Glucose is a form of sugar that is the body's basic source of energy. Glucose is the major fuel for cells in order for them to have their normal functions. So even though some cells can fuel themselves basically with other things in the body, brain cells cannot. So glucose, think of it as brain food. Brain cells cannot use anything but glucose. When these cells are deprived, they basically start to dysfunction. And when they dysfunction, they cause altered mental status. And then eventually the cell begins to shut down if it's still lacking this glucose for its food, and it causes even further altered mental status. And eventually the cell will die if the drop is severe and it is prolonged. And if there's too much glucose, it kind of acts like salt. It acts like salt in the sense to where it draws water molecules with it, just like salt does. So, which this can be dangerous to patients with head injuries and stroke, because then you're talking about when blood sugar is elevated, you're going to have basic increase of pressure inside the brain where head injury and stroke occurs, increasing ICP, which can make things really bad and fatal. So let's talk about these hormones. The first one we want to talk about is insulin. Insulin is a hormone that's secreted by the pancreas that lowers the blood glucose level by promoting the movement of glucose from the blood into the cell. The next one is glucagon, a hormone secreted by the pancreas that raises the blood glucose level by stimulating the liver to convert glycogen and other substances into glucose. Insulin. Insulin increases the movement of glucose into the cell. A lot of people think that the insulin itself carries it into the cell. That's not true. It actually attaches itself to a part of the cell that opens another part of the cell that allows it to move across the membrane by another protein, carrying the glucose into the cell. So, what happens when insulin is not available or not enough? This process is a lot slower. So, therefore, it causes elevation in blood sugar, which can cause a lot of problems. So, glucagon, it does the exact opposite of insulin. Glucagon is released when glucose levels are really low. This usually happens when glucose falls to about 70 milligrams per deciliter. We'll talk about how it's measured later. This helps by converting non-carbohydrate substances and glycogen that are stored in the liver into glucose to help raise these blood sugar levels. So now that we know how metabolism works and how sugar is regulated in the body through insulin and glucagon when it produces glycogen, let's talk about the tests that is used to determine diabetes. This test is called a hemoglobin A1C. We do not perform this test in the pre-hospital setting. This is done in either the clinic or hospital setting itself. This test is used to determine the severity of the disease by putting you on a scale, a numbered scale with a certain percentage of your sugars being uh, so high at this number that is rated on this scale. Just for example, it is a 2 to 3 month period of average glucose that it detects, and it helps you find out the basically almost the type of diabetic that you are, whether you are a type 1 or a type 2 diabetic, which we will be discussing here in the next slide. So with the A1C test, you can basically determine the two types of diabetes that there is out in the world. So the first type we're going to talk about is type 1. These diabetics were known once as insulin-dependent diabetics. Usually these diabetics don't secrete insulin on their own, so they need help from an outside source of insulin, like insulin injections. There's different types of insulin from fast acting to long acting. It all depends on what your provider puts you on. You're usually diagnosed as a type 1 diabetic between the ages of 6 and 4 and 10 and 14, which is the peak set of onset between these ages. And you can also be diagnosed in the age of 40 or less. These type of diabetics are more prone to diabetic ketoacidosis. Why? Because these diabetics will usually run high in their blood sugar levels, and we're talking about extremely high. That is why they seek these management of outside insulin. So the next type of diabetic is a type 2 diabetic, which was known as a non-insulin dependent diabetic. These patients do not need to take insulin. They are capable of attempting to control their diabetes with diet and exercise and a form of an oral med that helps insulin move into the cells by aiding the pancreas so that it doesn't have to work so hard. And it is usually found in middle-aged to older patients, and these patients are very susceptible to hyperglycemic hyperosmolar syndrome. So the next thing we're going to talk about is checking the glucose. So how does it work? We check the glucose by obtaining a capillary blood sample through a finger stick utilizing a lancet, a glucometer strip, and a glucometer, which will give us a reading by us putting that sample in that strip inside that glucometer. That's inside that glucometer, and it should read either give us a number And the normal ranges that are considered normal are 80 to 120 milligrams per deciliter. Anything lower than that is considered hypoglycemia. Anything higher than 120 is considered hyperglycemia. And let's talk about treatment. Let's talk about treating hypoglycemia first. When does hypoglycemia occur? When your blood sugar falls below normal and it starts to affect the patient. What are some signs and symptoms to look out for? Diaphoresis, tremors, weakness, tachycardia, dizziness. The patient can present to be pale, cool, and clammy. Um, they feel warm sensations, they feel confused, drowsiness, disoriented. Some of them even present with stroke-like symptoms, and in severe cases, seizures can happen, and so can be unresponsive. How do we treat hypoglycemia? Well, at the EMT level, we treat it with oral glucose. This is a medication that can be administered by EMTs. It is a heavy sugar gel that contains 15 grams of sugar, and it aids in raising blood sugar and hopefully improving the mental status. So, what is one of the contraindications of giving this medication? You cannot give it to the patient if the patient is unresponsive. Why? Because the risk of choking and aspiration. So, you want to refrain from any time giving oral glucose or anything orally to the patient when they are unresponsive. The next thing you want to consider to make sure that you do is your ALS backup. In case your patient does go unresponsive, there is more things that they can do and help treating hypoglycemia. So the next thing we're going to talk about is hyperglycemia, right? Since we got to know what hyperglycemia is in order to help treat it. So hyperglycemia is defined as a glucose greater than 200 milligrams per deciliter. And this occurs because there is a lack of insulin to help move the glucose into the cells. So it's just lingering in the bloodstream, right? And because of this, it may result in DKA or HHS. So let's talk about what happens in DKA. Dehydration is one thing. The glucose in the body is so excessive because there is no insulin to help move the glucose into the cells that frequent urination happens. And remember when I said that it acts like salt? It's going to carry excess amount of water when you urinate, so it's going to dehydrate the body. And it's going to signal the brain on top of that to produce more glucose because the cells that uh, require sugar think they're starving of sugar because there is no insulin to move the glucose into the cell. So the other thing that's going on is acidosis. How is that happening? Because the liver is not receiving the cells in the liver are not receiving sugar. It's going to metabolize fats for energy, and it's going to create a byproduct called ketones. And these ketones, of course, are going to create a strong acid, causing the body to reach dangerous levels of acidosis. So HHS is similar to acidosis. The only thing difference is that the sugar levels are extremely higher, and the frequent urination is going to cause the severe dehydration, therefore causing the hyperosmolar effect. So how do we treat DKA and HHS? Like we do everything, managing our ABCs, ventilating if necessary, providing oxygen, making sure that our airways are patent, doing everything according to your local protocols. And if you have to, contact medical direction for further instructions. All right, guys, hope we learned something on diabetes today. See y'all later.